This is 1 in 36, a presentation of the Anderson Center for Autism. 1 in 36 is a weekly show devoted to autism spectrum disorder.
Good morning and welcome to 1 in 36. You heard it right. That's 1 in 36 is the new name of this podcast. It is a show dedicated to all topics related to autism spectrum disorder. And I am your host, Eliza Bozensky, Chief Development Officer at Anderson Center for Autism. The new name of the show reflects, as it always has, the current statistics published by the CDC on the number of children in the United States currently diagnosed with autism spectrum disorder. It was recently 1 in 44. When I started this podcast, it was 1 in 88. That was several years ago. And so as we're going to talk with our guest today, the numbers continue to rise in terms of that particular statistic. And we're going to talk about some implications in the field with our guest today. Dr. Deborah Napolitano, who is the Associate Professor in the Behavioral Sciences Department at Daemen College and has been in this field for a number of years. Debbie, thank you for being on the show.
Thank you for having me.
You're very welcome. So yes, you are our first guest under this new name, and we're going to have a conversation about not so much the study itself. We've talked about that in the past on this podcast, but really, the numbers are not turning around. They're not stopping. They're not slowing down. They're continuing to increase in this particular study. So I know that, we're going to get into a lot of different topics, but why don't we start can you tell us a little bit about yourself and your background, what got you to where you are at Daemen College doing what you're doing?
Sure. Yeah. So I am a licensed behavior analyst, and I have been a behavior analyst since 2000, I think. I was very fortunate. I went to school at the University of Kansas, got my PhD in developmental and child psychology, and then eventually was recruited to New York, which is where I am now. I live outside of Rochester, New York, with my family. I have been working particularly in the field of area of advocacy in behavior analysis for a very long time as a member of the New York State Association for Behavior Analysis. I was at one point the president, more recently the chair, and now the co-chair of the Public Policy Committee. So through that work with NYSABA, I have worked very hard to advocate for our field, for a license for our field, and a variety of other issues. And because of that, I've also become more actively involved in legislation and public policy in general, and the issues that are facing many of the individuals and families who happen to be diagnosed with autism or autistic disorder. And I have a lot of concerns about where we're heading in our state right now.
You are not alone, I would think, here and probably elsewhere, but certainly in this state. I think advocacy is something that I see firsthand amongst the families at Anderson. We have an Anderson Family Partners group who sort of founded themselves several years back with a small group of engaged families, and that group has continued to grow. And one of their three main sort of areas of focus is advocacy on behalf of their loved ones. And what it often comes down to, even though there's many issues that you could choose from within the field, the one that pertains to them mostly that they really focus in on are the ones that have to do with direct support professionals, specifically what direct support professionals are paid, which many would argue is not a living wage. And you can see that firsthand when you see how many DSPs are working several jobs to make ends meet or are leaving the field. to take something, to do something that maybe they are not passionate about by any means, but they need to take because it allows them to live. But also, I think on a bigger picture, not just funding, but also a just general sense of a recognition of the work that DSPs do and the importance of it. And from a family's perspective, they're looking at whoever will listen to say, these people are taking care 24/7 of my child, whether my child is 8 or my child is 54. They are doing this. And why do we seem to struggle so much in professionalizing that role? So I'll throw that at you. What's your reaction to that?
I have a lot of reaction to that. First, is that I actually came into this field a little differently than a lot of people. I think, I actually started out as a DSP, and in that role, it's where I learned to love, working with individuals, in particular at that time, adults with disabilities. And I recognize the need for myself for increased skill set around being able to support them effectively. And that's how I became interested and started to love behavior analysis. Went back to school to become a behavior analyst. Through that process, before that, I was a director of residential programs, and so I've had the opportunity to really not just understand from the perspective of someone who works so closely with direct support professionals, but having been a direct support professional, to understand how hard that job is and how fulfilling it can be, because it really shaped my career, obviously. But unless we invest in the field, and unless we invest in that role and professionalize that role in a way that makes it a career, we will continue to have such significant turnover. It's not just that many DSPs have to work as much overtime as possible or get a second job. They are also accessing government assistance because they're not making enough money to support their families. Right. And if you are in a job where you are not making enough money to support your families, that's not a job you would consider a good career move. And so we have to really be thinking about this as a profession, and how do we help ensure that happens, because that's the only way we're going to sustain the systems in our state that support the individuals that their family members, the family members of these advocates that you're talking about. I have the great fortune to be, I'm on the board of Parent to Parent. And even though I'm not a parent of a child with a disability, I'm on a local, similar to probably the parent group at the Anderson Center, regional parent group here in the Rochester area, because I have had the great opportunity to meet the most passionate, compassionate, amazing parents who have literally devoted their lives to advocating to ensure that their loved ones have what they need, especially after they're gone. And it is heartbreaking to see their reaction to what happened, particularly with this most recent budget. Yeah. There was an actual belief that this was going to happen this time, that there was going to be an 8.5% cost of living adjustment for DSPs, and that was cut in half. And people are expected to think, okay, well, 4%, that's still 4%, but that doesn't even begin to address the problem.
No. And 8.5 would have been okay, but it's the history of the funding disparity goes so far back.
Yes.
That's you starting with 8.5% some could say it's just sort of arbitrary, because it's, it sounded good, but then 4 sounds, I guess, like you said, you can make the argument that at least it's something, but the problem is it's not enough. And I think you nailed it when you said that there's no real way for most people, or most anyone, to look at a DSP job as a career path. Now, at Anderson, we do, I think, some creative things. I'm sure there are lots of organizations that are thinking far more creatively than we ever have had to in terms of both retention and recruitment of our staff. We have career tracks. We have opportunities to grow. We have this newish role called registered behavior technician, which I'm sure you're familiar with.
Yes.
Which is, a lot of our staff have taken advantage of that training and have become RBTs from a role as a DSP. But I just would suggest, and we're almost at our break, but curious your thoughts on, are we really talking about a much bigger societal sort of cultural, if you will, change in the way whether you're a board certified behavior analyst, have your doctorate, don't have whatever path you're on, when we're in human service, should we be looking at just the recognition that taking care of each other and human to human contact and care should be far more valued overall than it is? I don't know when that change happened, but it seems to me that we need to make a change there.
I agree 100%. And I would have thought that COVID taught us that. And, of all, to see that the real heroes throughout COVID in so many sectors, but including direct support professionals who went to work day after day when so many of us had the luxury of working from home. We would have thought that I would have hoped would have taught us that compassion and that understanding, the need to be able to take care of each other and to look out for each other. And I don't see that being a priority, unfortunately. And I think that it's actually reflected even more so, and something that concerns me a lot is the entire service system, particularly in how persons with disabilities are treated in terms of the supports that are available, and so many of the issues that we see where they end up in places they shouldn't be because the service system itself is broken. So it's beyond the DSP problem, which is a huge problem in and of itself.
Yeah, no, I agree with you. I mean, I think Anderson just stepped into the world of preschool. And so my understanding now is that the preschool waiting list, which means that there are children who are very young, who some argue benefit greatly, sometimes far more significantly and faster to intervention at a much younger age, are sitting on waiting lists instead of being in classrooms. Yes. With experts. And on the other side of things, as people age, the idea of aging with dignity, aging in place, having a place to live after you graduate from school at age 21, there's a significant gap, AKA failure on that end too. So it's, I don't know, I'm getting worked up now. I'm a little stressed out. I'm going to take a quick break. We're going to come back, and then we'll go into a couple other areas with Dr. Debbie Napolitano from Daemen College. This is 1 in 36, the weekly talk show on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky, and we'll be right back.
If I could be you.
And you could be me.
For just 1 hour.
If you could find a way
to get inside
each other's mind.
Walk a mile in my shoes.
Walk a mile in my shoes.
Walk a mile in my shoes.
We've all felt left out. And for some, that feeling lasts more than a moment. We can change that. Learn how at belongingbeginswithus.org. Brought to you by the Ad Council.
Walk a mile in my shoes.
And now, 1 in 36 continues on 100.7 WHUD. This is a weekly community affairs program presented by the Anderson Center for Autism.
Welcome back to 1 in 36, the weekly talk show on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky, and I'm talking today with Dr. Debbie Napolitano, who is an associate professor in the behavioral sciences department at Daemen College. We've been getting ourselves, I think, each other just back and forth, discussing under the framework of the change in statistics of children being diagnosed on the spectrum in this country from 1 in 44 to 1 in 36 recently. But a lot about DSPs, our society, how we view sort of the caretaking, the human services field as a whole, funding, the recent budget in New York State, lots of topics. I want to pivot a little bit because I know that you have a degree in applied behavior analysis. You sit on the public policy board for NYSABA. Way back, many years ago, I actually for a few years ran Anderson's clinical department, which is now called our behavioral services department. I do not have my BCBA. I'm a social worker, actually. That's my educational background. But I was managing that department more from a standpoint of the department at the time really needed kind of an identity, to come together, to learn to be collaborative and to work well within the framework of a larger organization, because we're not a storefront sort of offering ABA services. We're a residential large program serving children and adults. So it was a huge learning experience for me. And one of the things that I remember doing a lot was trying to help this group of mostly young professionals who were very eager to make an impact and to help the people we're serving to at the time, I guess the language was, learning replacement behaviors and just sort of, be able to be more successful and independent in situations where they weren't, necessarily always going to have somebody right next to them, helping them. So it was a noble effort, but they struggled a lot with collaboration and working with other departments who were working with the same people, but had a slightly different purpose in terms of their role. So I'm curious if you have any commentary on, or when you're working with your students, do you ever talk about best practices in professionals in the world of ABA, working successfully in a collaborative model? Because you're working with DSPs, residence managers, nutritionists, dietitians, speech pathologists, OTs, PTs, administrators. How does it, and families? What do you get into that? In your work?
Yes, that is actually something that's very near and dear to my heart. Interprofessional collaboration is something that I have learned a lot about in my practice, but I don't think in our field that we focused a lot on that in our training. But I think that we're making a shift in that because it's so important. I've been really fortunate to have learned from, particularly one of the roles that I didn't mention is that I am also a consultant with the Golisano Institute for Developmental Disability Nursing. And in my role as the consultant, I bring an interprofessional lens. So I get to work with the most amazing nurses that I could ever get to work with. And, but in that role, I have a value to them and vice versa, because there's so much importance in this collaborative role in understanding things from multiple perspectives to make sure that we are really understanding the best ways to treat complex issues. All of the issues that we talk about, or most of the issues that we talk about when we're looking to solve problems, are complex, and to think that we can solve them with one person or one profession just isn't realistic. And so one of the things that we focus on at Daemen in particular, and that is important for me, is that collaboration and that collaborative approach. I also do most of my work, my clinical work now, where I've done a lot of work in the OPWD system, but most of my clinical work is actually in the OCFS and juvenile justice system. And as you can imagine, that necessitates working with professionals from many different professional backgrounds, but not just professionals. One of the things that's inherent in interprofessionalism is working with the families, with the individuals, and direct support professionals, where everybody has a voice at the table. And if you do not have all the voices at the table, you're going to miss something important. And so that is really a big focus of how we train our behavior analysts now. I hope that that's where most programs are moving. And I think that, that comes from being a newer professional field, as we're getting our professional legs under us.
Yeah.
We've been around for a long time, but in terms of the field itself, having licenses and certifications, those things come with time, and I think that we're moving in that direction.
That's great to hear, and it's cool that that you see a shift, because that's a nice recognition that that something needed to change for the better of the individual. And I agree with you. Problem solving is always complex. Doesn't mean it's not addressable or that there is an opportunity for success. It often means that you need all the voices in the room. I agree with you 100% on that. The other thing that is definitely out there in a big way right now, with a lot of media coverage and a lot of new voices or voices that maybe had been quieter in the past, is which I'm watching, and reading about. I'm fascinated by it just because at Anderson we are in a niche, right? Anderson Center for Autism serves, generally speaking, people who are profoundly affected by autism. This is a, autistic/IDD population. Most of we have a long history. We're turning 100 next year. We're having our
wow,
centennial.
Congratulations.
Thank you. But we started out serving over the decades, many different populations, but since the late 90s, early 2000s, we've really been focusing on serving autistic children and adults who are typically have very complex behavioral challenges, many of whom are non-vocal, communicate in different ways. And we are considered, at least the term used to be, a restrictive environment. We're a residential program. We enjoy, thankfully, a lot of family engagement. Families are here on our campus. Students and adults go home frequently. But that is a very niche population. And so I've seen that ABA has made the news a lot because there's also, I think, more and more self-advocates who are speaking up about experiences either they had or opinions that they have about ABA, and opinions just about all sorts of things from terminology, language, diagnostics, or a sense of just, this is just me. And nobody should be intervened with. Nobody should receive something different. So I don't know. It's a hot topic. It's up to you if you want to comment, but I'd be curious. I guess I'm curious if you get different questions now in the classroom, or when you're on your board meetings or in your family groups. Is the discussion around that stuff changing too?
It is, and I think it's an important discussion. Excuse me. One of the things that I think is extremely important is that we're listening to all the voices and all of the people with experiences and all of the persons who have thoughts about services that they've received. Just because somebody, so just because I think that the work that I may do would not be considered abusive in any way, doesn't mean that somebody hasn't engaged in a bad practice and called it ABA. The thing about behavior analysis that is sometimes hard, I think, is that people confuse behavior analysis with a therapy, and it's really a science. And the science kind of just is. It's a science of how people behave. How people apply the science is a whole different ballgame. And that's the way that I certainly think that there's some authenticity with the way people have been treated. And, humans are humans, and humans do good things and humans do bad things. And sometimes they do them because they don't know better. And sometimes they do them because they do know better. And unfortunately, it's sometimes weeding through all of those voices to make sure that we're keeping the good and not getting rid of the good, but getting rid of the bad. And I think that being person first and really taking into account what the individual wants and what the individual needs, and as our first line, the way that we start any conversation is an important way to approach things. And I do think that in our field, we're coming around to that probably more quickly than I even thought. And I think it's a very good thing.
That's great. That's good to hear. What you said before about, it's a science, and then there's the application and the practical application of that science. Going back to my historical experience here at Anderson, that was a big thing that we needed to be focused in on. Was just because you have the information and you've studied it and you have your certification, it's a different skill to be able to apply that knowledge in a practical setting with real human people who have families and who have a whole team of other people around them. and who are individuals and have different hopes and dreams and a different sense of what their quality of life means to them. So I think that's really important. You are lifting my spirits. The first half of the show, I think we got really kind of worked up about some of the things that are really hard right now. But
yes.
I think just hearing you talk about this huge part of the field and this science and just where you are in your thinking and where your students are and where the people you're working with are seeing things change, I'm feeling much more optimistic. So thank you for doing that.
Great.
Thank you for being on the show. Again, you are our debut guest for 1 in 36, and I really appreciate all your time and expertise.
Thank you for having
Dr.
me.
Debbie Napolitano.
And thank you for all of the work that you do at the Anderson Center.
Well, you're very welcome. We love what we do. So we're going to keep on doing it for another 100 years, hopefully.
Yay. That's wonderful. It's so needed.
This is 1 in 36, the weekly talk show on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky. And remember, Anderson cares.
You've been listening to 1 in 36, a weekly presentation of the Anderson Center for Autism. Join them for another edition of the show at this time next weekend.